Osteotomies are a well-recognized treatment for unloading affected compartments in cases of lower limb malalignment. Opening wedge distal femoral osteotomies are an effective way to treat patients with valgus malalignment. The Arthrex femoral opening wedge osteotomy surgical technique requires preoperative evaluation, including standard full-length AP radiographs. Rosenberg and patella views are necessary to determine the amount of correction for the valgus-aligned leg. The degree of correction is calculated to restore normal physiological alignment with the patient. In a supine position, a 4 to 6 centimeter incision is made over the distal lateral aspect of the thigh. A retractor is placed posterior to the femur to protect the neurovascular supply. An anterior retractor may also be placed to protect the quadriceps muscle and to create space for the saw to breach the anterior cortex of the femur. A 2.4 mm breakaway osteotomy guide pin is placed under fluoroscopic control approximately 15 mm proximal to the femoral trochlea, angled obliquely toward the medial epicondyle. An optional second pin may be placed using the parallel cutting guide under fluoroscopic control to preserve slope. Once secure, the breakaway pins are shortened and a sagittal saw is used to perforate the femoral cortex superior to the guide pins. Osteotomes are used to complete the cut under fluoroscopic control, leaving 1 centimeter of bone intact medially. The depth markings on the osteotome blades may be referenced on the breakaway pins. Once the osteotomy is complete, the breakaway pins are removed. Once assembled, the paddles of the osteotomy jack are inserted into the osteotomy. Slowly and over time, the jack is opened until the degree of desired opening is achieved. The contour lock femoral osteotomy plate is positioned in between the osteotomy jack paddles. Small medium for corrections of 0 mm to 10 mm, and large extra large for corrections of 10 mm to 20 mm. The spacer is placed securely over the opening created until the plate is flushed to the lateral cortex prior to screw fixation. 3 6.5 mm cancellous screws are placed in the plate distal to the osteotomy. Four 4.5 mm fully threaded bicortical screws are used to secure the plate proximally to the osteotomy. Conventional fluoroscopic technique should be used for pre-drilling and depth device measurement to determine appropriate screw length and position. A fourth optional fixed angle locking screw may be inserted distally if additional fixation is deemed appropriate. Once the plate is secure, Allosync Pure demineralized bone matrix, comprised of 100% human allograft bone, will help facilitate bone remodeling at the osteotomy site. Contour lock plates are available in titanium and stainless steel. Select the appropriate sized contour lock femoral osteotomy plate based on the left or right femur and amount of correction.